to MMWDM. I'm your host, Dr. Murphy. On today's show, we'll be throwing it back to ancient Rome and how they developed their own methods of medicine. As many people know, the Romans were known for their great achievements in architecture, intelligence, and government, but they were also very ahead of their time in surgery and medicine. To give you viewers a quick description on how they practiced, we've brought in a patient who needs to be operated on, so you can receive a first-hand look on what methods they used. One of the Romans' advancements was their preparation. Romans developed a type of antiseptic, or way to clean their tools before using them. This helped save lives tremendously, often on battlefronts for soldiers because it prevented wounds from becoming infected. However, today we'll be operating on another in need of a C-section. Back in ancient Rome, Caesar declared a law that stated all women who died in the process of labor had to be cut open, and this resulted in the cesarean section, or C-section. Although our patient today is not fatal, nowadays many women will have C-sections because of an infection or other complications in their pregnancy. We are now ready to operate, and today we have a woman who has been in labor but is incapable of natural delivery. Alright, to begin, we will be using scalpels. Scalpels in ancient Rome are much like today's scalpels and are used to make incisions. There were two general types of scalpels in ancient Rome. First, we use a long, narrow scalpel to make the large incision at the bottom of her belly. Next, we use a bellied scalpel to make smaller, delicate incisions. Now that her stomach and uterus have been opened, I will grab the baby from the uterus and I'll give her to one of my nurses to clean. Meanwhile, I'll remove the placenta using a hook. Hooks were typically used to lift and remove blood vessels or pieces of tissue back in ancient Rome. However, they can be used for many procedures. Unfortunately, our patient has suffered a minor complication and has fractured one of her lower ribs. To repair the fractured bone, I'll use a bone lever to reposition the fractured rib so it can heal correctly. Bone levers were another common tool used in ancient Rome. They were used to reposition fractured bones, and also they were used sometimes to lever out teeth. Well, I finished up by sewing her abdomen, and I'll have my nurses clean her up. I see they finished taking tests and measuring our newborn. And here she is. The parents have decided on the name Avery. What a coincidence! I have a niece named Avery. As we finish up here, folks, let's take a recap of what we've learned. First, we know that Roman Emperor Caesar declared that mothers who died during labor needed to have a cesarean section. Then, we learned about Roman antiseptic and how they cleaned their tools before using them to prevent infections. Lastly, we learned about tools, such as scalpels used to make incisions, hooks to lift or remove tissue, and bone levers which were used to reposition fractured bones. Overall, Romans were able to develop safer ways to operate and prevent further injuries to wounded patients. Even today, we are still able to see the advancements of Rome's surgery and medicine through tools we use like scalpels and antiseptic for cleaning wounds and tools. Often, we just slightly enhance or modify the tool that we're using. Well, folks, that's all the time we have for today, but be sure to tune in next time on MMWDM. I'm your host, Dr. Murphy.